dry needling is similar to acupuncture in the sense that we use needles, we use solid filament needles, but from there, they're very different. That's about all it's the same, because we use solid filament needles that are very thin, very small, that are inserted into the skin and into the muscle tissue with the whole intention that we help to alleviate some pain or tension around trigger points. And trigger points are areas of muscle all across the body that are mapped out and have a lot of consistency from person to person that can become tight, that can become rigid and painful, and has been noticed to get some relief or reduced tension after a needle is placed in them. And so there are certain patterns, certain areas that correlate very well with each other. Neck and shoulder is a big one, low back and hips, thighs, knees, and of course ankle and lower leg. We do a lot around the elbow as well for lateral epicondylitis or tennis elbow, but a lot of those places can be very beneficial when pain or tension is primarily caused by muscles. So when you are moving and feeling like I could go further, but I feel like there's a rubber band or a tight rope that's restricting my motion. I can't move as easy because it's tight, like it won't move as well. That may be a good time to start looking at, is dry needling right for me? Or when you've stretched and stretched and stretched and you feel like I keep stretching, it's not getting looser, dry needling might be a good option for you. The other time I get quite good results with it is if you've had this nagging, lingering pain, you've done massage, you've done stretching, and maybe you've even done some exercises to hope that it gets better. Dry needling can be a good option for you to help alleviate some of that tension, and then back it up with a very specific exercise program that's going to be specific to your needs. So trigger point dry needling is great for those folks, not great for people who have a big fear of needles, and that's very real, that's okay. People who have issues with or uncomfortable with having needles in tissue is also people who don't respond very well to it. So if you have any further questions about trigger point and dry needling, feel free to ask, email, no problem at all. But we look forward to announcing our winner. I believe it's tomorrow. So have a great day.